Hello there.
Hello.
Can you hear me clearly?
Yes, I can.
All right. I hope others will be able to join. It's now after 2, so I'm going to make a start, okay? Sorry about all the inconveniences. I I have to be up by the dean's office now just to teach this class because there's no power in the department. So this afternoon, we want to have a discussion on institutional health. There are a number of institutions here in Jamaica that house people for different purposes. We have institutions like schools and universities and hospitals and daycare centers, a range of penal institutions, and others that all fulfill some very useful purpose to society. But we ought to recognize that within institutions, there are various hazards, and so we need to focus on institutional health as based on activities that do take place in these institutions. People can be exposed to microorganisms, and people can be exposed to other physical and chemical hazards. So we want to discuss some of these key institutions and to see what can be done to prevent and control these hazards so as not to expose persons to ill health. So those are some objectives. So when we talk about an institution, we're talking about a complete property, its buildings, facilities, and services having a social, educational, or religious purpose. And there's a long list of examples there, which I just went through: schools, colleges, universities, hospitals, nursing homes, daycare centers, home for the aged, prisons, detention facilities, and so forth. Unfortunately, we will not have time to discuss all the institutions listed here. So I have singled out 4 for discussion for today: schools, hospitals, daycare centers, and prisons. Now the question might be asked, why institutional health? We need to understand that most institutions are communities unto themselves. They all have certain basic characteristics that require careful planning, design, construction, operation, and maintenance. And therefore, the environmental, health, engineering, and sanitation concerns at these institutions are in many instances quite extensive and complex. And if we don't pay attention to these, then people could get sick. Now, institutions do provide an ideal environment for the spread of communicable diseases. Just think about it. Schools, universities, hospitals, prisons, daycare, nursing homes, they all provide an ideal environment for the spread of communicable disease. And let's bear in mind that in some of these institutions, like hospitals and some nursing homes, the health of people there are already compromised. And if they're exposed to other hazards, like biological hazards, then certainly in the case of hospitals, they could develop what we call nosocomial or hospital-acquired infections. Within institutions, accidents do occur, and so there's an increased need for accident prevention and control. And of course, there is increased challenge to attain and maintain optimum health. And by doing so, we can prevent or reduce economic loss. Now, there are several spheres of knowledge required for effective institutional health. Of course, they must have effective management who will be responsible for planning a range of activities surrounding how the institution should operate optimally, accident prevention and disease control, water supplies management, waste management and emissions control, vector control, ventilation systems, operations and maintenance, laboratory and toxic substance management, housing standards, plumbing and building requirements, biohazards, ergonomics, and physical hazards management, aseptic techniques, and of course, health promotion. So for an institution to serve its population best, knowledge is required for effective institutional health, and we will delve into these as we proceed. Now, there are some key factors that should guide environmental health decision making in institutional health. We need to pay attention to current best practices based on the institution and legal compliance. In other words, there are legislation that apply to a number of institutions, and these need to be complied with in the interests of the population served and the general population as well. Another factor is the susceptibility to disease of the population served by institutions. Certainly, daycare caters to the need of children who are very susceptible. They're young, and some of them might not be immunized. And so we have to bear in mind the susceptibility to disease of the population served by the institution. Certainly for primary schools as well as nursing, as well as daycare, there is a requirement for full immunization of children. But we now live in a world where some parents object to their child being immunized, and that may in some cases be a legal matter. Also, there are numerous potential routes of disease transmission in these institutions, including water, air, through fomites in the case of hospitals and nursing homes, and other areas. All right. So the quality of potential exposure of the institution's dependence on the workers to disease, chemicals, and injury-causing elements must be of utmost concern, because while the population served will get priority attention, we also have to pay attention to the health of workers who provide care for these people. So this is just a list then, in no way all-inclusive, of some of the typical diseases or conditions that are associated with institutions. And we are trying here to focus on those that we are going to be discussing. So in schools, very possible for hand, foot, and mouth disease to be transmitted. Head lice, Conditions associated with immunizations if children are not immunized. There is influenza, norovirus, pertussis or whooping cough, pink eye, shigellosis, scabies, and others. For daycare centers, chickenpox, poles, influenza, pink eye, diarrhea, hepatitis A and B, lice, measles, and also the question of immunizations. For nursing homes, pneumonia, UTI, urinary tract infections, a range of skin infections, soft tissue infections, of course, foodborne diseases. For prisons, you typically encounter bloodborne pathogens, hepatitis B, hepatitis C, HIV, a range of other sexually transmitted diseases, MRSA, methicillin-resistant Staphylococcus aureus, Mycobacterium tuberculosis, influenza virus, herpes, injuries, and people in prisons could also develop NCDs based on the length of their incarceration. So institutions provide the opportunity for the transmission of infectious diseases, for the occurrence of accidents which can cause injuries, and also for the development of some NCDs. So if one is going to set up an institution, whether it be a school, a daycare, a prison, a hospital, there are certain critical planning and design considerations. First of all is spatial and land use planning. So we expect our townships and our cities to be zoned into residential, commercial, and industrial areas. And so we should not place an institution in a zone which would violate the arrangements for that zone. So it is important that whatever land we are going to put the institution on is suitable, is of sufficient size to facilitate further development in the future. Secondly, one need to consider the current and projected population growth within and outside of the institution, the requirements in respect of national, regional, and local development planning, and certainly there should be evidence-based decision-making as to location, operational scope, and resilience of the facility. So planning is of utmost importance if one is going to put in place an institution of whatever kind. So let's talk about the building or the buildings, and this is just a general discussion, right? Certainly the type of institution will greatly influence the siting and design of the facility. So one is to consider site and location issues. Clearly, if you're going to build a hospital, you will want to build it in the center of the town, surrounded by highways and industrial operations, right? You would want it to be in a quiet area where pollution is not great. You have to consider the layout, right? The construction materials. Certainly you wouldn't want to use hazardous materials in construction, floor and walls and ceiling and roofs. So one would have to give serious consideration to things like carpets, if you're going to use carpets, as opposed to tiles. Certainly I would prefer tiles in preference to carpets. You wouldn't want any ACM. ACM stands for asbestos containing material. So as good as ACM is for in terms of providing insulation and all those good things, ACM of all type is a carcinogen, right? It can lead to lung cancer, can lead to mesothelioma, can also lead to asbestosis. MMF stands for man-made mineral fibers, and man-made mineral fibers have been used as an alternative to asbestos containing material, but because they are fibers, potentially they can cause quite similar problems. So we have to be careful in terms of the materials that we use for construction. Certainly we need to consider the cost, but we need to consider whether the material is hazardous or non-hazardous. Certainly staircases, corridors, and ramps, all buildings should have ramps to accommodate people with physical disability. You wouldn't want to have a daycare, for example, where it's housed on the third floor of a building in which children have to climb stairs to get there, right? You wouldn't want to have that. And in any case, if you're going to have staircases, they should be protected with rails that people can hold on to, because you don't want people to fall. Ventilation is an important consideration. You need to have adequate air changes to facilitate comfort and to facilitate the removal of certain particles and possible microorganisms in the indoor environment. So clearly you would want to have a mix of natural ventilation as well as artificial ventilation, whether it be in the form of general dilution fans, extractor fans, or air conditioning. And for air conditioning, there are going to be two options: central air conditioning and the use of the split system. And I just want to remind you here that for whatever building, whatever institution, central air conditioning is the better option because it supplies fresh air, okay? The split units do not supply fresh air. They just cool the air that is present. So if the air is contaminated, you're going to get cool contaminated air, or if it is not, you're still going to get cool air, right? Cooling and heating requirements generally is not a big issue here in Jamaica. You know, we try to make it into one by blocking out natural ventilation. But I don't think we have any system here that requires heating of buildings, certainly not. But in other jurisdictions, cooling and heating requirements should be part of the discussion.
Question
again, natural and hello?
Are you able on your end, are you able to turn your volume up to maximum? I'm not sure if it's max.
You're not sure if it's max. All right, let me.
It's a little low on my end.
Okay, you could be right. Let me just check it. Are you hearing me any better now? Hello?
A little, yeah.
Okay. So lighting is another important consideration. And we can consider in terms of artificial and natural lighting. The plumbing system must be looked into because it must provide safe removal of waste material. You really don't want the plumbing system to fail, which may lead to the accumulation of wastewater on the property, as this could serve as breeding places for mosquitoes, as well as provide a very offensive odor. Noise control is also important, so one has to pay attention to the building acoustics and of course distance from noise sources. That must be part of the plan. You want to be located, you want the building, the institution to be located in an area that is far from major noise sources. Considerations for the physically challenged, we already mentioned ramps, but there are other things that should be considered. Food service facilities. Certainly for an institution, it's probably best to have the food provided at the facilities, as whenever food has to be provided elsewhere and transported, it can be problematic. And always one needs to know where the food is coming from for any institution. The best arrangement is to have facilities at the institution where food can be provided and served in a very safe manner. Solid and liquid waste management, all institutions will generate solid waste. Some will generate solid waste that are of hazardous nature, like in hospitals and nursing homes. All of them will generate liquid waste, which can be disposed of on-site, or if a sewage system connection is available, then that connection will have to take place. But these things must be considered. Laundering, again, for some institutions, these services have to be provided. Recreational facilities for many institutions, this is a must, certainly in schools and colleges. But even in prisons, you need to have recreational facilities. Certainly for children in daycare, one has to ensure that whatever recreational facility is provided, it is safe and does not contain objects that could cause injury to students, because recreational facilities contribute to both physical and social development. And of course, security. This is a big issue now in the Jamaican context. I remember the days when hospitals didn't have security guards. I remember the days when schools, whether it be primary or high schools, did not need security guards. But I would think that for all institutions now, security in the form of security guards. The fact that the fact that they didn't have security guard didn't mean that security was not present. But just to say that nowadays it's very commonplace to see security guards at all institutions, and some institutions have scores of security guards. The question I ask myself in many cases is, what kind of security do they provide? Imagine going into a hospital now, you have somebody patting you down, searching you to see if you're taking any offensive objects inside the facility. Those things never existed 30 40 years ago, but security seemed to be a big item now. And if you analyze it carefully, you may conclude that in some cases, the security that is provided is probably not better than a false sense of security. So here we are. We are living in a society which is very violent, and so the need for physical security has become a must for many institutions. All right, so there are some special considerations for kitchens. If the institution has a kitchen or kitchens, then attention needs to be paid to food storage and preparation, washing and sanitization. Here in Jamaica, those kitchens would come under our licensing regime, as those kitchens would be considered as a food handling establishment, and all food handling establishments in Jamaica must be licensed by law, right? Again, in the case of hospitals, some hospitals, I don't know if it's all, but certainly I know of some in which the food preparation service is contracted out. And if that is done, then efforts should be made to ensure that whoever gets the contract satisfies the requirements for preparing and serving safe food. So they not only need to be licensed, but the food handlers need to be certified by the Ministry of Health. For hospitals, delivery rooms, operating theaters, isolation rooms, they need very special consideration based on what goes on in these places, right? So the operating theaters must be fully air conditioned with satisfactory indoor air quality. Same thing for your delivery rooms. And where you have isolation rooms, these would preferably be negatively pressured, right? Security features are also very prominent in prisons and in some hospitals, right? So we're living in a new age where security has been enhanced in many situations. So we're going to be looking at institutional health in these four settings: schools, prisons, hospitals, and daycare centers. We want to start with schools. Now for schools, an effective school health program is recommended, and school health is promoted by the WHO as a means to prevent important health risks among children and adolescents in effort to change behaviors that impact health. So school health is very important. I don't know the extent to which we are trying to get health promoting schools in Jamaica, but it is highly recommended. So conceptually, a school health program would address all the issues you see listed here: comprehensive school health education, physical education, school health services, nutrition services, counseling, psychological and social services, health school environment, school site health promotion for staff, and family and community involvement. So conceptually, a school health program will have three main participants. It will have the students or the children, it will have the parents and the community, and also the teachers. And from time to time, health professionals could be invited to make series of presentations to students and staff about matters relative to health. So conceptually, school health program is very wide and covers, I think, all the areas that needs to be covered in promoting not only learning at school, but getting children to practice healthy habits, enhancing the health literacy of the school population, and so on and so forth. So a school health program is justified for many reasons, and some of the reasons are listed here. The WHO reported a tenfold increase in childhood and adolescent obesity in 5 to 19-year-olds in 4 decades. If you look around Jamaica or any other country represented in this class, you will see that overweight and obesity in children and adolescents is increasing. And we readily point to fast foods. The fast food is only part of the problem. We have to look also at physical activity, all right? Fortunately or unfortunately, when I was going to high school, I had to walk 3 or 4 miles in the morning to get the bus, but that was no big thing because everybody walked because there was no bus service in my community. So we had to walk, and by walking every day, that helped us. All right. Nowadays, children don't walk anywhere. If they live a few meters from school, they still take a taxi or the parents drop them off. All right. So we have a problem. Again, as reported by the WHO, over 40% of the global burden of disease attributed to environmental factors fall on children less than 5 years of age. And children 5 years and younger account for only about 10% of the global population. In many areas, including the Caribbean, worm infestation are the greatest cause of disease among 5 to 14-year-old. And here we're talking about roundworms and hookworms and pinworms and all kind of worms, right? Vitamin A deficiency is the single greatest cause of preventable childhood blindness. Iodine deficiency is the single most common preventable cause of mental retardation and brain damage in children. So there is more than enough justification for school health and youth health promotion because there are so many problems that affect the young children that can be dealt with, and if they are not dealt with, it could affect the child's development and capacity to learn and become the best person he or she could become. In addition, injuries Yes, go ahead.
I'm
Let-
sorry. I just wanted to add that not only that, but the attitudes towards health and well-being to developed from the earlier age, sticks
Mhm.
with and goes with the child. And also we know that they influence the
Mhm.
behaviors of the entire family.
Mhm. Yeah. Yeah, I take that point as well. The fact is that I would think here in Jamaica, we don't have enough parents, for example, who contribute to the Parent Teachers Association. Many of them don't even know it exists or attend the meeting. They
Not
only
at
turn up
all.
at school if there's a problem with their child. All right. The fact of the matter,
Mm-hmm.
the fact of the matter is, listen, students are a very captive audience, and they can be influenced by teachers. In some cases, students will believe what the teacher says over what the parent says. Guys, teacher says so, right?
Yeah.
Teachers are
Yes.
teachers are considered infallible by by students. But we have the students, we have the teachers, we have the parents and the community, and there need to be more cohesion between the three. The three need to come together because there are things the community can do for the school, there are things that parents can do, right? And if they
Mm-hmm.
fail to do that, then some children may go astray. Because let's face it, in the community, we have professionals
Yes.
who can contribute a lot to the school, right? Um, 1 out of injury is a leading cause of death and disability among school age youth, right? 1 out of every 2 young people who start and continue to smoke will be killed by tobacco-related illness. So we need to understand that students start to smoke at an early age. And we can't wait until they become adults to be telling them about the dangers of cigarette smoking. And much of this education can take place within the context of the school and its operation. We have to be careful not to overburden teachers, but we need to understand that probably there needs to be a greater health input in terms of the curriculum of schools. And then those of us who are health professionals, whether it be a nurse, a public health inspector, a doctor, a pharmacist, medical technologist, whatever, we too can contribute to any school health program, whether or not we have a child going there. Just by living in the community where the school is, we can and should try to make a contribution, right? These statistics are really, are really terrible. Worldwide, 5% of all deaths of young people between the ages of 15 and 29 are attributable to alcohol use. Alcohol is legal, just that people under a certain age are not legally allowed to buy and consume it in public. Fact of the matter is that a lot of children have enough alcohol to drink at home. They need not go to the shop to buy alcohol to drink, right? In some countries, up to 60% of all new HIV infections occur among 15 to 24-year-olds, right? Let us all remember that we still have the HIV pandemic going on, and that the recent COVID-19 pandemic dealt a serious blow to HIV AIDS prevention, as a lot of the resources were diverted on HIV AIDS program to COVID-19 control programs and all of that. All right, if you look at lead as an environmental toxicant, it's a big problem in the US. Not as big a problem in the Caribbean as it is in the US, but it's very expensive to treat childhood lead poisoning in the United States, right? And based on what they did a cost-benefit analysis, and they found that for every $1 spent to reduce lead hazards, there's a benefit of $17 to $220. And they concluded that this cost-benefit ratio is better than that for vaccine. You know, vaccines have long been described as the single most cost-beneficial medical public health intervention. All right. All right, so the WHO has put forward school health strategies, and the main goal is to increase the number of schools that can be truly called health promoting schools. And they define health promoting school as one that can be characterized as a school constantly strengthening its capacity as a healthy setting for living, learning, and working. It would be good to find out if we have any school here in Jamaica that we could truly call a health promoting school.
Well,
Go ahead.
first we don't have a school health policy.
I'm not hearing you very clearly, but go ahead.
I was saying, firstly, we don't have a school health policy.
We don't have a school health policy.
No, we don't.
And
Surprisingly enough, we don't.
yeah, and I'm saying that is very unfortunate, because within the Ministry of Health, we have what is called a Bureau of Health Education. And we have a number of health education specialists which are being trained to the master's level. Some people in this class will end up getting a master's degree in.
Question though, Dr. Scarlett.
Sorry?
Yes, Dr. Scarlett, are you hearing me? Hello?
I'm hearing you, but not hearing him. Are you hearing me?
Yeah. Yeah, man, I'm hearing you, Vanessa,
Oh.
hearing you.
I'm wondering if he fell off.
Probably having some issues.
Yeah, man, he did. I don't see him among the persons listed. The participants, he's not there.
Okay.
Remember, he did say there's no internet on campus, no power, so probably where he is had some problems now.
Simone, you were asking if that's a fact, if it's
Oh, no, man. What I wanted to ask was where you guys mentioned that there was no school health policy. I wanted to find out if that responsibility would rest with Ministry of Education or with Ministry of Health. So I wanted to get his feedback on that.
well, it has to be a collaboration. The Ministry of Education isn't equipped to produce a school health policy on its own.
Okay.
So
Okay.
it would be a collaboration, which is what we're trying to do, but it is taking forever and a day.
Okay, understood.
Because it's a very comprehensive And what we've had to do now is to sort of split it and be looking at, okay, we need to get this part done, we need to get this done, we need to get, and see if we can get some aspects of it done. And then, go to the other aspects until we compile a full policy document.
Okay, I
But
see.
it's quite haphazard what is taking place now. Because infrastructure that should be in place so that these policies could be worked out, that's not in place in the Ministry of Education.
I am wondering if
So-
this is something that the Ministry of Health could probably take under its wing, because I
Yes,
know that there is a institutional health specialist assigned to the EHU, the Environmental Health Unit. So I'm wondering if this is something that they could take on in collaboration, of course, with the Ministry of Education. Since we are able to make health policies. So I'm wondering if that is something they could
that's what I'm
consider.
saying. That's what I'm saying. It has not been done. You have had some little pieces of things over the years, guidelines and principles, little pieces of things, but not an actual policy. But it falls under the Family Health Unit of the Ministry of Health. It
On the
is now,
family
it has
health.
now, yeah, the Family Health Unit. That's where it falls under the Ministry of Health.
I see.
Mhm. But part of the problem is that the personnel that should be in the Ministry of Education to liaise with the Ministry of Health in formulating this, they're not in place.
Okay, noted.
So it's actually the school nursing special interest group, which is an advocacy body, not a policy body under the NAJ, that is trying to work with the Ministry of Health to produce the necessary things.
I see.
Understand? So it goes back in this class and on right throughout the classes, we're seeing that infrastructure is so important in the management of structures and systems. So, yeah.
Yeah, man. Seems as if Dr. Scarlett not coming back on. Seems as if he's really having some issues.
Yes, we should soon hear from the office. What's happening?
Mm-hmm.
I came on late. Did he explain about the brief? Did we ask him?
I'm not sure. Anybody else? You guys heard him say anything about the brief?
No, he didn't speak about that. He just introduced the class and went on.
Okay.
Okay, cool. Thanks.
No problem.
I guess towards the end of the class, we can clarify. Oh, Daniel is here? Daniel, are you on?
Does she normally do environmental health?
Oh, probably not. Probably not. Because I think she's on part-time. So she's probably not doing it. Oh, so it's research time. Okay.
Mhm.
Good afternoon. While we're waiting, is anybody planning to physically go up for the next session, or are we still just waiting to hear if light would come back at UE first?
I am waiting to hear it. I don't want to go all the way up there and then hear that class not keeping up there. And then I'm thinking about the traffic that is going to be up that side because of the thing that they're having by is King's House.
I think everything is gonna be online. I was speaking to Candice because I'm here with nurse. So
Oh, thanks so much. Thanks for that.
Thank you.
I mean the light come back, but I think everybody I could just do online based on what I get. Like I will find Sebastian to find out if him know that Dr. Scarlett got kicked off.
Okay. Because I think if you're not at UWE already, I don't think you're going to be able to get through going up there with all the blocking offs and Worthington Avenue road situation and all of that.
Guys, log off and log on back because Dr. Scarlett is still teaching. So maybe it's us.
Oh, okay, thanks.
All right.
So he probably doesn't even realize that he's not here.
I'm still not seeing him among the participants, you know.
Yeah, somebody needs to contact him and tell him that nobody's
Anybody,
actually here.
anybody has a number for Dr. Scarlett?
Candice already spoke to him just now.
So he basically was just talking to himself.
Yes, he was. He was teaching away.
Hope he's recording.
Hello, I understand that I may have lost you from time. Is that the case?
Yes, Dr. Scarlett, for a good
Yes,
little
sir, for
bit.
about 15 minutes or so.
Oh my God. All right, Jesus. About 15 minutes. All right.
Last thing we heard was a school health. We're talking about the school health program, and you were saying or we're discussing that there was the absence of a school health policy. That was the last thing you would have discussed with us.
Really? Oh my God. All right, let me go back. I was here talking to myself. Okay.
Right there, right there. Mhm.
Right there. All right. Good. All right. So I went through all this, but let me go through it quickly. There was a global school health survey, and Jamaica participated in that survey. So this is some of the summary data for 13 to 15-year-olds who participated. So among students who ever drank alcohol, 80% had their first drink before age 14. Among those who ever drank alcohol, 35% reported being drunk one or more times. So there's no shortage of alcohol here in Jamaica. If it's not at home, it can be bought quite easily by teenagers at the corner shop or somewhere else, because these people want to make a living, so they sell these things, so they're not mindful as to whether you are overage or underage. They will still sell it, and some of them even assume that you're buying it for your parents, which is not the case. So 28% of students were overweight or obese. That is a problem. 80% reported using drugs before age 14. 23% of students seriously considered attempting suicide during the months preceding the survey. Just last week, or was it just last week, there was a report of a student who apparently committed suicide because he didn't like how his mother was trying to discipline him. So I don't know. 22%.
I thought he was being bullied.
You
Yeah,
thought it was?
they put out a message to encourage or to discourage bullying. That was the message, I think, from some child health organization or whatnot. But based on how it is that the newscast was reported, it sounded more like what you said earlier in terms of some discontentment with his mom and so.
But that wasn't the case.
It's ambiguous because the messaging was saying stop bullying, but the report was more so the mother. So it's really either or. Who knows?
Yeah. Oh boy. It's whatever the reason, it was very, very unfortunate and sad that a
I think,
30-year could go that way. Yes, go
excuse
ahead.
me, sir. I think the issue was twofold. So he was actually being bullied, and his mother was trying to get him to come home earlier to prevent the bullying. So it was almost like he was being bullied at school and then felt that his mother was being
Hard on him.
overly harsh, or almost like he was being bullied at home too.
Wow. Yeah. Anyway, communication and the way the messages go, sometimes you get the wrong impression, but anyway. So 72% of students drank carbonated drinks one or more times per day in the last 30 days. So, all right, so I was saying that here in Jamaica, the Ministry of Health announced restriction on sugary drinks in school. Does anyone know how well that is going now?
Something was passed in parliament, in cabinet or parliament the other day with the whole policy about sugar sweetened beverages in schools. So I guess it's gonna be an implementation phase now, seeing that it was just recently passed.
I thought it was implemented already.
It was actually implemented from last year, My children's school actually changed the juices that were on offer. I don't think they've tried to get juices that have a reduced sugar content, but not necessarily juice per se. If
So
you get
the
what I'm saying. So it's not 100% juice that they're selling. It's just that they've chosen drinks that have lower sugar content.
this kind of campaign is not
So-
easy, you know, because listen, a number of children, more and more children are taking their drinks from home. All right. Who's going to control the amount of sugar the parents put in the drinks at home for the students?
But we don't find that they're taking so much, you know, from home,
buying.
but they buy from outside. It's not so the low sugar content is something which started from 2 years ago. It's a part of the school nutrition policy, and it's been in fact in effect 2-3 years ago. 2025 now, yeah, 2022 thereabouts. But the school health policy was just passed.
Okay.
The school nutrition policy.
Okay. One of the problems with the sugary drinks is that we need to understand that they have a number of artificial sweeteners on the market. Sweeteners which are 10, 12, 15 times as sweet as cane sugar. So the person who's making these drinks, they're buying these sweeteners, so they don't lose when the drink is sweet, because the sugar, what they get to buy is very cheap, and they can get liters upon liters upon liters of drinks. Because one could argue if a manufacturer could put less sugar in the thing, he would benefit more because he's using less sugar. You understand me? But in targeting children, they try to make the thing as sweet as is possible, because they know children will prefer a sweet drink to one that is not sweet. That is part of the issue.
And what we found happening when this came into effect is that companies had started, because the problem is with the white sugar. It's not cane sugar that is the problem. It's the white sugar that is used. But what companies were doing is they were switching from that and using the artificial ones, as you mentioned, which not only are just as sweet, but they have other implications for illness in other ways attached to them.
But
So it was, you know.
Yeah. But let me say this though. Do you know that all the sugar we produce in Jamaica is exported?
Yes.
And we then import sugar, you know that?
Yes.
So these guys don't bother import the sugar, they import the sweeteners, right? So that's an issue. I mean, this is a good attempt, but it needs to be thought through properly, right? So I don't know. Anyway, St. Lucia was trying to ban the sale, and maybe they have by now. They banned soft drinks in government schools in Trinidad. In the United States, they found that banning all sugar-sweetened beverages in middle schools resulted in reduction of in-school access to these drinks, but not the overall consumption. So students were still buying these drinks outside of school and all of that. So it's a big issue. I don't know how we're going to solve it. Anyway, in a school health program, one that is properly organized and run, these are some of the typical services that are provided: control of communicable diseases, This is done mainly through immunizations, right? We have the EPI disease expanded program on immunization here in Jamaica. And certainly in schools, students are not admitted unless they are fully immunized. And also ensuring that students have safe water to drink and safe food to eat, right? And safe facilities for excreta disposal. In many rural areas, schools still have pit latrines and all of that, right? Minimizing non-communicable defects, things like accidents resulting in injuries of one kind or another. We have had stories of children dying on playing fields of some schools, or that the goalpost drop on them or something else happen, right? Provision of health through nutrition. That's very important. We need to address nutrition in schools. And in addressing nutrition in schools, we may find at all times that it is necessary to provide meals for children. Providing meals for children in school is not new. When I was going to primary school, certainly we had a canteen so we could get a cooked meal, but it was sold to us. A few years ago, you had the NutriBun program, and now government is planning to provide some meals for students at school. I think that should be done because many students attend schools in the morning without breakfast. And certainly, if a child is hungry, it's going to affect his or her ability to learn. Provision of adequate physical activity for children, that is possible in all schools, but some schools lack adequate facilities, playing fields. Sometimes the playing field is not safe. There are too many rocks or other sharp implements that could easily harm students. I am surprised, and I'm expressing it now. I've done it before. I am surprised that given the prominence of Jamaica in world athletics, we should make a more sustained effort to ensure that we put in place a structure that will facilitate the development of young athletes. But I don't think we're doing it. We're just hoping that somebody will come through and become great, right? We should be doing these things from primary school, and I'm afraid we're not doing it. Cricket is almost a dying sport in Jamaica now because it's not being promoted in a lot of schools. So I don't know. I don't know what the authorities are thinking, right? But we need some intervention. Health education and promotion, very, very important to improve and enhance health literacy, both in teachers and students. The fact of the matter is that teachers are not adequately prepared to teach health-related topics. They are not. And maybe we could call for a greater input of this teaching in their training curricula. But clearly, this is an area in which the health department can work with schools to fill this gap.
They have what they call the HFLE, Health and Family Life Teacher. Health and Family Life Educator Teacher. But still, there's much to be desired there. But the school nurses help to fill that gap.
Well, how many schools have a school nurse?
But right, so that's the thing. They're only available in high schools, and not all high schools have and such. But the health and family life teacher is supposed to bring across the health topics.
Question. For that HLFA teacher, is that so that's somebody who is on the school's payroll, or is that somebody from the health department? I'm just curious.
Good question.
No, they're employed through the Ministry of Education.
So
they're on the school.
great.
They're taught. There's a curriculum. There's a curriculum developed in conjunction with the Ministry of Health.
So which schools are they in? Are they in every high school?
Yes.
In every primary school?
I am not sure that they're in every primary, but they're at the high school level, definitely.
You see, there is so much neglect of the primary school, as if children don't leave primary school to go high school.
And yeah, that's where the Ministry of Education misses the mark a lot in not starting programs from early childhood education and primary level, implementing them in the high school. They miss the mark a lot with that. Yes.
Okay. All right. The other thing is integration of school and community health programs. More can be done in that area. But we need leadership. We need to do more of mobilizing and organizing communities to help themselves to solve their problems. But that has not been done to any great extent. It used to be done much better in the past. I don't know. Anyway, let's move on. So in terms of effectiveness of school health promoting schools, this is coming from the WHO, and they told us that programs that promoted mental health in schools, including preventing violence and aggression, show these programs to be among the most effective ones in promoting health. The fact is, from very early, students ought to be taught that health is their most important asset. All right? And many people don't see their health as an asset. They think of assets only in terms of houses and cars and land and buildings, and all those things are good. But no matter how rich you are, if you don't have good health, you have a big problem, right? And each individual can do things to protect his or her own health. We can all invest in our health today. And the same way you buy some bonds today or whatever, and it reap dividends in the future. If students are taught and implement actions in terms of preserving their own health, they're going to reap benefits. So they might have, we are certainly going to have less NCDs in the future if that were to be done, right? But who is trying to inculcate that in our students, the fact that health is an important asset and we can invest in our own health. Powerful message, but is it being spread out there? All right. Anyway, so these are some approaches that have proven to be good. Multifactorial interventions, particularly those involving changes to the school environment, were effective. Peer-delivered health promotion was found to be more effective compared with teacher-led interventions. And I find this very interesting because this is something that students would enjoy doing. And if they did it and they're telling us now that is more effective compared to when teachers do it, I mean, that's a good thing, right? Programs that focus on promoting the prevention of substance abuse were found to be relatively ineffective. So there are successes and there are failures. These are just some recommendations for comfort in select locations in schools. Certainly you need to have good ventilation, 10 to 30 cubic foot per minute per pupil of fresh outside air. Relative humidity should be greater than 30% and less than 60%. Ideally, it should be 50%. The fact is that students need to be comfortable to learn. And what I see happening now, because people are vandalizing schools, the type of windows that have been put in schools now do not allow as much fresh air to enter the buildings as before. Have you noticed that? Anybody notice that?
And the windows are vents largely just angled pieces of concrete when it is at its
Exactly,
cleanest.
exactly, and that reduces the amount of fresh air that enter the building. So, I mean, many people don't understand, that this vandalism and this crime and violence is affecting us in so many ways. But students need to be comfortable to learn. And if we're going to have overcrowded classrooms with poor ventilation and high relative humidity, then we'll have a problem. So this is lighting for classrooms or different sections of buildings. The fact of the matter is that light does not need to be consistent from one section of a building to another. So these are guidelines. And these are recommendations for sanitary facilities. I'm going to ask you to read through them. Every 30 to 40 girls, one toilet. Every 30 to 40 boys, one toilet and one urinal. It varies here. Drinking fountains are not so popular in schools anymore. So let's talk a little about prisons. Our time is going. Prisons. All right. Prisons are a fact of life. When we run afoul of the law and are found guilty, we may end up in prison. The reality is that anybody can go to prison, right? Anybody can go to prison. However, in our society, we find that most of those who go to prison belong to the lower socioeconomic grouping, but it's not that they're the only ones committing crimes, People higher up in society are committing crimes, but they have the resources to to avoid going to prison, and we have to accept that as well. Now, in 2015, the British Prime Minister announced a prison transfer deal. He was going to give Jamaica £25 million, and Jamaica would in turn accept prisoners from the UK, and this was rejected by the Prime Minister at the time. Would you have accepted this prison gift? Any comments? Would you have accepted this prison gift?
Not unless that 25 million pounds would be able to build out a new facility with all the requirements.
Yeah, but you're going to end up with a prison, a new facility, yes. Who's going to maintain that facility when you get prison from UK? That wasn't part of the deal, right? So we need prisons. We need new prisons in Jamaica, but probably that was rejection of that offer was probably a good thing. I don't know what you think. Anyway. Now, there's a quotation here. Prisoners are sent to prison as punishment, not for punishment. Do you agree?
Yes, at Her Majesty's what's the word?
Pleasure.
When it is
Pleasure.
basically keeping at Her Majesty's pleasure. Thank you.
But is it true that prisoners go to prison as punishment and not for punishment? What is the reality?
Yeah, they are going there because what now is going to be the case where you end up with persons there for a long time before, I guess, even a proper trial has been conducted.
But then get some serious licks in prison, right?
Yep.
And they are at liberty of being raped and beaten by inmates and prison guards and all of that. But we need to note that prisoners have inalienable rights conferred upon them by international conventions. They have a right to health care and not to contract diseases or be abused in prison. All right? So we need to accept that. And if we are to provide health care for prisoners, we probably shouldn't focus on the fact that they are prisoners, but on the fact that they are human beings deserving of care than anybody else. All right. So again, prisoners shall have access to the health services available in the country without discrimination. The UN, whatever, basic principles for the treatment of prisoners there. But in many developing countries like Jamaica, prison are no bed of roses, right? Agree?
Agreed.
Prison are no bed of roses in Jamaica because, boy, it's kind of hard, you know. Kind of hard to go to prison and you find yourself with 10 other people in the cell and there's a bucket for you to use for defecation and somebody else take out that bucket in the morning to empty it. That don't look good to me as an environmental health person, right? Even though somebody's in prison, my own view is that you still need to recognize basic dignity of the human being and all of that. But in Jamaica, we have a negative attitude towards prisoners.
But it depends on what you think prisons are for. In terms of, is prison supposed to be a rehabilitative space, or is it just somewhere to section off people part-time and then bring them back home?
Agree. If you ask anybody in authority in Jamaica, they will tell that prison is for rehabilitation, right? And then they'll ask them what forms of rehabilitation are going on in prison, and then you realize the argument stop right there, right? The fact is that prison can be bad for public health, right? So no condoms, no sterile drug needles, no disinfection facilities for needles. We need to remember, you know, that prisoners, if they survive, they come back into society. And they're going to take whatever disease they did contract in prison back into society. All right? So, I don't know. I don't know if we're doing the right thing, but anyway.
Sir, I think you raised a great point that a lot of people don't remember, that unless you get a lifetime sentence, you at some point you're going to need to come back into society. So if you put me in a situation where I'm being treated less than human and you remove so much of my ability to empathize and sympathize, when I get back, you've actually created somebody who is worse than when they actually went in.
Okay.
And then we look at they call it the recidivism rates in Jamaica. How many persons who go to jail actually return there? And then you recognize that we have a problem.
Well, some people prefer to go back to jail because they tell you they get 3 meals a day. And when they're free, they don't have anything to eat. You know, so I don't know. I really don't know. Well, I don't think.
Are we creating situations where people are able to, I spent 3 years in jail. When I get back to society, am I better off? So you knew that I couldn't read when I got to jail. What was done in the 3 years to help me to become literate so that you knew that I was unskilled when I came there. And we know what the link between education, skills, and being able to take care of yourself, the difference that it makes in the decision making of people. Yeah, so what is the work that we do? So if you recognize that I'm at a bad place and we don't do anything to get the person to a better place, and then just release them 3 years later, we're not really doing anything.
Well, one of your colleagues raised the issue, rehabilitation is just as almost a misnomer in our situation, because I am not aware of any meaningful attempt at rehabilitation in Jamaica prisons. And people in prisons, we also need to recognize that people go to prison who are innocent, you know. People go to prison who are innocent, just that they couldn't prove it because they probably couldn't afford an expensive lawyer. But the fact is, you go to prison, that should be bad enough. You have enough time to learn a skill while you're in prison. So I think you should be facilitated. Don't you think so?
I
You
do
should,
agree. And the
yeah,
Ministry of National Security does have programs that target inmates. However, these programs tend to favor female inmates as opposed to male inmates.
okay, okay, yeah. Oh boy. All right. So health and human rights issues in prison, of course, violence is everyday reality in many prisons, sexual abuse, human rights, healthcare, food, recreation, rehabilitation, conjugal visits. Do you think they will ever formally grant conjugal visits in Jamaica?
I think they should, because it's done in the US. They should have a area or a wing for that.
Well, I tell you this, whether they approve it formally or not, it is taking place, you know. Maybe not in the prison. I'll tell you a story. I had a friend who who was a prison warder many years ago, and he related a story to me. He said that when Mr. Big was sent to prison, like say at the gun court, right? What Mr. Big would do when he wants to be with his wife or girlfriend, Mr. Big would report that he was ill, and they would be asked to take Mr. Big to KPH, but instead they would take Mr. Big to Pegasus or other places, and on their return, they would stop and buy some Panadol and stuff to take to take back to say he was coming from the doctor. So you see how long ago corruption has been going on in this country, right? So some people go to prison and they still get conjugal visits, even though it's not
I didn't realize
formally
it was
approved.
so fancy because I hear about stories where they let them go in the bathroom to use a bathroom at at prison or
Yeah.
at court or so forth. But
Yeah.
Mr. Biggs have it.
Listen to me, this is Jamaica. Anything is possible if you have money.
It's a lady told me a story that she went to look for her son while he was in prison, and when she went, she heard that he was in the hospital, and she ran to KPH to find out what happened to her son, why I'm in hospital. And he was at home with his baby mother. The police allowed him to go home to his baby mother and tell him when to come back. And she was there running up and down saying something happened to him.
Yeah, it's a known fact that people get night off to go home and come back, you know. I've heard stories of people trying to beat traffic just to return in time. But anyway, this is Jamaica, land we love. All right, so our prisons, there are some special construction features. I just want to mention them to you. So of course, goes without saying that the building should be structurally sound, fire resistant, elimination of exposed electrical wiring, you know what that can cause. But look at this one. ASHRAE in the United States recommend 50 square feet of floor space per inmate. About how many square feet do you think each inmate in Jamaica get?
5. Dr. Scarlett.
If so many, if you have 10 people in a room, 10 by 10 or 10 by 12, you understand what I'm talking about. Sleeping facilities should be provided. You know, most prisoners in Jamaica sleep on the floor. Lucky for a piece of cardboard. Minimum 1 shower per 15 inmates. You're lucky. 1 shower per 15 inmates, not in Jamaica.
But why is that, Dr. Scarlett? If these are standards that I guess it's how people
No, the
view
standards
prison.
I'm referring to are American standards. We just don't adapt them, right? We don't invest in those things for prisoner because deep down we say them are prisoner and them deserve to be treated badly. I think that's
Right.
that's the mindset, you know.
Because
But I
even how
remind
it
people
was
every day.
constructed, why wouldn't they give them, you know, water closets? Why wouldn't they give them flush toilets from the get-go? Even though the prisons were made, I guess, a long time ago. I don't know.
Right.
I guess it's just the mind.
Yeah, one water closet for every 8 inmates. That's a joke. Fire safety facilities, indoor and outdoor sanitation. In most cases, out in Jamaica, you have outdoor sanitation. You have a pit outside here, and they take out the bucket with the feces in the morning to empty it and all of that. Adequate recreational facilities, that is limited. Exercise, maybe. I don't know if you get opportunity for daily exercise in Jamaican prisons. I don't know. I don't know. All right, a quick word on hospitals. We're running out of time, but I need to speed up a bit. Certainly, a quotation here, hospitals should transition from being the last link in the chain of health service providers to being actively engaged with the communities and with providers of primary care. I think in this country, we place most of our resources in secondary care, which is hospitals. And I think that we need to invest more in primary care. If we invest more in primary care, then less people would end up at the hospital. But politicians, I don't know, they just like the hospital and the fact that you see the building. You don't see primary care, right? Very often you may see a small health center. And that, I don't know the mindset. But we tell people that prevention is better than cure, and I tell you that they believe it, but you shouldn't listen to what people say. You need more to watch what they do, okay? What they do, because it's easy to say the right thing, but you don't do it, all right? So hospitals are important. The whole concept of nosocomial infections, people being admitted to hospital with one disease, contract another disease while in hospital and may end up dying from the disease that they contract in hospital, right? So nosocomial disease are an issue. I don't know if we have any system in the Jamaican hospital system to recognize and record and report on nosocomial infections. I doubt it. Because if there was a system for doing that, then more people would end up suing the administration, right? But it is happening. And one of the main reasons why you have nosocomial infections being spread in hospitals is just the failure of healthcare providers to wash their hands, you know. It's as simple as that. Failure to wash their hands. You know, and that causes people to get sick and probably die. All right, these are some terms I'm going to ask to read on your own in the interest of, right. So in the hospital situation, there are 3 main sources of hospital infection. The patients themselves can be a source of infection to others, the personnel in the hospital, as well as the environment. And these are the different routes of transmission: direct, indirect, airborne, vector-borne. We have what we call the 4 precautions. And you need to be familiar with the 4 precautions. So we have standard precaution. These are things that health staff engage in to prevent themselves being infected or to infect other people if they're not well. So there is standard precaution, which basically applies to every situation in the hospital. So whether or not you know the diagnosis of the patient, you ought to practice standard precautions. So simple things like appropriate PPE, certainly gloves and coverall, and in some cases, respiratory protection. And then you have contact, droplet, and airborne precautions. These are what we call transmission-based precautions, because some diseases are spread through physical contact, some through droplets, and some through airborne. So let's look at them. So these are just elements of standard precautions. There was a
Question
question?
is, yes, sir.
Yeah. Go ahead.
So the standard precautions it is that you had mentioned, it kind of confusing me a little bit because when it is that you mentioned PPE and so that sounds more contact based. I was wondering if standard would have more so been like, I guess, like hand washing. That's something that you do regardless of whatever somebody has, or say the sanitation of the surfaces that they're gonna lie down on or sit on and that kind of stuff.
All right. Standard precaution used to be called universal precautions. Remember that word? So
Yes,
there
sir.
was a, right. So standard precautions are a number of approaches taken by health staff to protect themselves or others. So it includes hand hygiene, washing the hands, personal protective equipment of one kind or another. It sometimes include respiratory hygiene, cough etiquette. So for example, you may be in the hospital now and somebody's admitted and that person is coughing a lot. You may see the need for respiratory protection at that point in time. It's not that all the while you're going to do it. You understand me? So there's something you do routine, but there's something you may be forced to do at a particular time. And the fact that somebody is coughing doesn't necessarily mean that the person is suffering from some serious infectious disease, but you still take the precautions, right? So cough etiquette, of course, you cover your cough. Prevention of injury from needles and other sharp objects. Cleaning of patient care environment. Those are standard things that are done. And of course, biomedical waste management, you need to have the right kind of storage for different kinds of waste. What is illustrated here is much more extensive than what is practiced normally in Jamaica, right? But basically, what standard precautions mean is that you take steps to protect yourself, right? Whether or not you know the diagnosis of the patient. So there are standard set of things that you do. Typically hand washing, wearing of gloves, and other PPE. The transmission-based precautions now, there are contact, droplet, and airborne, right? So for contact, certainly gloves and gown. You may do other things. For droplet, surgical mask is a must. The thing is that you always use standard precaution in association with any of these three. So if you're going to do contact precaution, you must also practice standard precaution. So these precautions, they do not stand by themselves. You have to do standard precautions, right? For airborne, you're going to need an N95 respirator because whatever you are exposed to may be transmitted in the air. All right. So let's just look at a brief summary of this. So you have standard at the top here, and standard goes along with any of these three. And then you have airborne, you wear your N95 mask, and these are some of the diseases of concern: tuberculosis, chickenpox, measles. Droplet, you wear a regular surgical mask. Influenza, meningitis, mumps. Recently we had COVID-19 and everybody thought it was droplet, and then we finally realized it was airborne, right? And then contact, use your gloves and those things. And for a number of these diseases, you could add you could add herpes to this list, because if you were to touch a herpetic sore with your bare hand, then you probably could be in trouble, right? So just go over these precautions. Standard goes with these three. These are transmission-based. Airborne, this says how the disease is spread. Droplet says how the disease is spread. And contact says how the disease is spread. All right? Prevention of nosocomial infections. These are a number of things you can do. Within hospitals, you have biosafety levels. Going through, I want to just read through these slides because I just want to touch this management of hospital waste. Remember that 75 to 90% of hospital waste is low risk waste, like ordinary domestic waste, is a 10 to 25% which are considered hazardous and need to be dealt with in a particular way. There are some documents put out by the Ministry of Health. They have a medical waste management policy. There's also a document put out by I think it's the WHO guidelines for the management of medical waste generated by healthcare facilities. I think they have a more recent edition of that. Sharp containers. We should stop using cardboard boxes. There are many appropriate plastic containers available for sharps. And we saw this when we talk about solid waste management. This is the waste management hospital, healthcare waste management facility downtown. And to the right is what the treated waste looks like. And we say a few words about daycare before we close. Back in 2018, when Floyd Green was the Minister of State in the Ministry of Education, he did make this announcement that there will be 126 state-run daycare centers a common stream by December 2018. I don't know how many of these state-run daycare centers have been built. Anybody have any idea? Anybody knows of any state-run daycare centers? I know there's one at the Ministry of Labor. That one was built long ago. But doesn't anyone know of any other state-run daycare centers in Jamaica?
I'm yet to hear of any after 2018. I don't know.
Okay. All right. So I keep telling you, it's not what people say, it's what they do. All right. All right. So at the Ministry of Labor, this is the Honorable Pernell Charles when he was the minister. They have a daycare center at the Ministry of Labor. You know, Pernell was Minister of Labor many years ago. But I don't know of any other state-run daycare center in Jamaica. All right, so for daycare centers, there are certain requirements. They must be licensed. They must have qualified staff. And they should have a criminal record which is clean. They need to have a current medical report on file. They need to be subjected to in-service training. They must be certified in first aid. You have group size and staffing ratios, so you can see what is it. Depending on the age of the child, a certain staff-child ratio is recommended, so you can look at that. Parental visit at any time during normal operation without appointment. So once you have a child at daycare, you don't need an appointment to go and see your child. Staff must demonstrate respect to each child. This is in the Child Protection Act. And there should be a good balance between active and quiet sessions. And children must not be left unattended at any time. And that is why the staff to child ratio is so tight. Source of infection. Workers can be a source of infection to the children. Children can be a source of infection to others. The food can cause foodborne disease. The water can be contaminated. Mosquitoes and rats and cockroaches, if they have access to the facility, can cause problem. And then you have fomites, which are inanimate objects that can be a source of infection. The doorknob, contaminated tabletops, all of those things. So in order to prevent disease in a daycare, you need to have the maintenance of hygienic standards. Hand washing is probably the cheapest and the best way to prevent transmission of infectious diseases. So frequency, proper technique in hand washing. You need to have the facilities. Diaper changing present a special challenge, right? And they require scrupulously clean and frequent. You need to wash hands very often. The diapers must be stored in a separate container, and certainly diapers should not be put out with regular garbage, as is the case in many instances. Regular cleaning and disinfection of environmental services, prompt cleaning and disinfection of soil surfaces. Sleep equipment should not be a safety hazard to the child. Of course, adequate immunization, that's a requirement. Safe water supply, disease surveillance, appropriate food handling procedures, policy for exclusion of sick children. So if they're sick, they should be excluded. Education of staff, all these are disease prevention measures, right? So we come to an abrupt end because I was trying to speed it up. I'd love to spend more time discussing some of the issues on the daycare center, but clearly daycare centers cater for children at a very vulnerable age, and the number of children being cared for by one attendant is very important. And certainly the care providers must be held to themselves in order to care for the children. And very importantly, also they need to have this clean criminal record. They should you see, people, you can have somebody who is a pedophile and they like working with children because they have access to the children, right? It's hard to identify these people, but if you have a staff working at daycare center, then clearly one should be alert to all the possibilities, all right? Because when you leave your child in daycare, you want to ensure that nobody takes advantage of your child. So one has to be careful in selecting a daycare. Good to do some background checks on the facility and those who work there, because bad things can happen, and I really don't want bad things to happen. Daycare is very important, especially nowadays where more and more mothers work and they need somewhere for their child to be, you know. So certainly we have come a long way here in Jamaica. The fact that we require daycare centers, or what they call early childhood centers, to be registered is a step in the right direction. The health department should see it as their responsibility to do regular monitoring of these facilities, right? To assist in educating staff, and all of that is important. All right, so I'm going to stop here. Are there any quick question or comment? Sorry I had to rush the last part, but so go. Are there any comments or question?
Only one comment, just because it's something that I guess I'd have seen. In terms of air quality also being a big issue in prisons.
Yeah.
We mentioned, well, poor ventilation there, but something that also occurs is that because of the confined space, and it is that the poor, I want to say, infrastructure with respect to going to the bathroom, and so What it is that some of the persons will do is also that they'll actually burn paper in the cells, so it is that the smoke can mask the scent of the fecal matter.
Yeah, I could understand that, but the other thing is that they shouldn't have matches in the cell, right? So you'd be surprised the amount of things that get smuggled into a prison cell. I watch some documentaries on US cable, and you would be surprised the amount of knives and the length of the knives that they retrieve from inmates' rectum. Right? And the knives were up there, didn't cut anybody. You get the point I'm making? So the amount of things that get smuggled into prison is not funny. Clearly, they shouldn't have anything to light a fire in the prison. But I can understand that, yes, you light the thing to make smoke, but they end up suffocating people. So I take the point, because to be in a room with a bucket of feces for the whole night, that in itself is going to be stifling to some people, right? So we are out here, we are free, and probably don't even care what happens behind those walls. But as I said, anybody can end up in prison. So I would love to see, you see, in a society like Jamaica where crime rate is high, you're not going to have much sympathy for prisoners. Do you agree? You're not going to have much sympathy for prisoners in a country where crime rate is very, very high. Anybody disagrees with that?
It's true.
Right.
And even what's so funny too, even the own prisoners themselves, when they find out what you're coming for, they take action on the person as well. As if they view one crime more, gruesome than another.
I just want to end by reminding you of what took place in Spanish Town some years ago. I mean, we know that prisoners have sex with each other, right? We know that homosexuality is a fact of life in prisons, right? And the authorities were recommending having condoms available in prison. And you know, the prisoners rioted because of that, because the prisoners were saying that you're accusing us of being homosexuals. But the fact that not all prisoners are homosexuals, but that kind of activity takes place in prison. And as a public health worker, I would support having condoms placed at strategic places so that those who want to indulge, because you can't stop them from indulging that activity, There's no way you can stop them. But at least give them protection. And that is my public health policy. But people are opposed to it. Some prisoners are opposed to it. But I don't know. What do you think? Would you support condoms being available in prison?
I agree, because they're going to be integrated, and some of them have wives or have girlfriends. And when they do their conjugal visits, they may, spread diseases. And then some are raped. So at least if the perpetrator uses a condom, at least
right. So
yeah, I think even if it is that they object to it, I don't think their objection to it really stops you from implementing it, because as you said, it's more so just if it is that you want it, you can use it.
Yeah.
If you don't want it, then just don't use it. But
Right.
not
So
having it there by policy doesn't make the behavior happen any less.
that is true. And it wouldn't be a situation where you have the person having to report to some person outside and say, hey, I need a condom. You could have a machine place at some point where if people need it, they go there and get it, and nobody's watching to see who's going to get this thing. You get the point? You get the point? So, yeah. Sometimes, we have our own beliefs and we try to impose it, but in terms of healthcare, we have to be practical, right? And anything which is going to prevent disease transmission without hurting somebody should be facilitated in some way, especially in prison, because clearly who want the condom can get it. Who don't want it, refuse it. But the fact is that you have sex men having sex with men in prisons. That is a fact. You know, so all we want to do is make it safer. All right. So I'm gonna stop here, and I hope tomorrow we can get back to normal. We need to have an invest. All right, so I'll see you tomorrow then. Good evening, everyone.